So with this research done, we had a plan. We had next steps. And we hit our second hiccup. That is data. Now, our sponsors included in their support package data. The data that we received was unique and it was interesting and it had potential to be really powerful, but it was instead quite limited. Now, this is a reflection on how difficult it is for government organizations to just release data. Even with strict data sharing agreements, they're extremely cautious, and rightly so, about sharing data with partners. Now, we quizzed our sponsor on the data that they had, and they admitted that they had so much more. But it took them months just to give us the data that they had given. And by the time they'd arranged to give us more data, the complete data set that would really help us, the SBRI would have been over. So it was time to look for our own data. So lesson learned, always have a backup plan, always have a second source of data. So I'd like to draw your attention to the hugely valuable data resources that are available through the open data initiatives right across the country. Now, for Northern Ireland, this means NISRA, which is the Northern Ireland Statistical Research Agency, which is a sister organization to the Office for National Statistics, but also the Open Data NI platform, and there are open data platforms for the UK in general. All have immense amounts of information on our public lives, population studies, geospatially, poverty that includes education poverty, environmental poverty, financial poverty. We have data about GP practices that includes information about the number of people suffering from respiratory problems, cardiovascular problems, long-term health problems. We have a wealth of data on prescription spending. All of this data is available. But what did we do with it? Well, we did what comes naturally to us. We are a software company after all, and we hoovered the data up. And we created a consolidated database, a consolidated data hub built from 11 different sources of data that covers hundreds of millions of rows, dozens of different aspects of public life in Northern Ireland. And we linked all of these, we aggregated all of these, and we created a model, a geospatial model that allowed us to explore this data and also to provide this data out to other people and to take in new sources of data through data feeds. And then we started looking at building on top of this, exploring how the data is related, how pollution and health and deprivation are connected. We were trying to understand what the data was telling us. We were looking for patterns.